Hi, it's Rachel from the KMC University Help Desk. On today's Help Desk episode, I wanted to talk to you about the restrict disclosure of patients' PHI to a health plan. And what I'm talking about is there may be a time where a patient comes in and asks you not to bill their health insurance, which is completely okay for them to do. For one reason or another, that is their right. So you're honoring the patient's privacy rights when it comes to that. Since the adoption of HIPAA Act in 1996, the privacy rule granted individuals the right to request restrictions regarding the use and disclosure of their protected health information for treatment payment and healthcare operations. The law also grants the individuals the right to request restrictions for other disclosures, such as those made to family members. It is up to the covered entities, which is you as the provider and the doctor, to determine whether or not to accept or deny the restriction requests. The high-tech HIPAA Omnibus Rule, effective September 23, 2013, took requests for restrictions one step further and required that a covered entity must agree to the request from an individual to restrict disclosure of protected health information about that individual to a health plan, if the disclosure is the purpose of carrying out payment or healthcare operations and not otherwise required by law. The protected health information pertains solely to a healthcare item or service for which the individual or the person on behalf of the individual has paid the covered entity in full. Essentially, this means that your patient can direct you as the covered entity or the office and provider to refrain from billing their health insurance for care in the office and can elect to pay cash instead. If the patient directs you not to bill the carrier because he or she has restricted your right to share PHI, such as a diagnosis, with this health plan, then you must determine whether you should choose to comply. Now, this process is not intended to be a workaround for providers to avoid Medicare enrollment by telling patients that the only way they can be seen in the office is to restrict their PHI. While there may be certain extenuating circumstances in which a provider may use a restriction, it's not to be a blanket policy directed by the covered entity. It is a process that should be initiated by the patient only. So what this means is you cannot ask the patient if they want to restrict their PHI just so they can pay cash. That is not okay. If the patient comes in and asks you as the patient to restrict their PI and that they don't want their insurance billed, that is okay. That is what is to do. Now, with that being said, when a patient does come in and ask you to restrict their personal health information from billing, there is a form that you do need to have completed, and that is called the Restriction for PHI form, and it's called a Restriction of PHI Self-Pay Acknowledgement form, and that should be within your HIPAA program. And when they ask you to restrict their PHI, you must have them fill that out. Now, that means that their health insurance cannot be billed at all by you or the patient. The patient cannot submit a super bill while their restriction of PHI is in effect. If for some reason down the road the patient decides that they want to lift that, then they need to also request that in writing, that they no longer want to restrict their PHI. So, patient comes in, they want to restrict their PHI, you have to honor that. That is their choice to restrict their personal health information, which means they have to pay cash for that service. That also means you can't bill and they can't bill either. It is not a workaround for Medicare. You cannot ask somebody to restrict their PHI so that you can't bill Medicare. That is definitely not an option for a chiropractor in the Medicare field, in the Medicare insurance.